Hello, and welcome to this ESC video snack, where we're going to look at the Mental Health and Cardiovascular Disease Consensus Statement, which was published this weekend in Madrid as the vehicle for the engagement of patient activities in the work of the ESC. My name is Richard Mindham. I'm a member of the ESC Patient Forum, and I'm here today with Hector Bueno, who was one of the co-chairs of the task force that led that clinical consensus development. So Hector, we're going to look in a minute, maybe, if we can find the time, to where patients made a difference within the document itself. But when I was very fortunate to be invited to join that guideline, I saw a huge passion in you for this topic. So what gives you, where does it come from as a clinician? Where does this passion for mental health in your cardiovascular patients, where does this come from?
Well, it comes particularly from my clinical experience, because I think this document is really triggering a big change. And actually, in a way, if you want to say a revolution, it's we've been so successful in treating cardiovascular disease, acute myocardial infarction, heart failure, and so on, that sometimes we forgot that surrounding the heart, there's a patient, and actually that the patient is a person with their feelings, with their emotions, with their social environment, and we have mostly ignored that. And I think this was a unique opportunity to really make a game changer in terms of highlighting the real need that probably every physician acknowledges. We know that that's a problem, but how to really deal with it. And I think this is a so unique opportunity to make a change and to promote a real cultural change in our regular practice that I thought, okay, we cannot miss it.
So do you think then it would be fair to say that the focus of even the people who fund healthcare has been on the biology, and there's been a neglect of the humanity in the dealing with the patient?
Well, I wouldn't maybe neglect this a bit strong, but yes, the focus is in obviously biological. But we have to understand that some years ago, some decades ago, people would die massively, particularly from cardiovascular disease. I can remember the times when we have acute myocardial infarction, the death rate was huge. Now with primary angiopathy, it's much lower. Same for heart failure. So in part of it has into this biological approach. So we have been very successful in biologically reducing mortality and the burden of disease. But that actually led to, let's say, consider a secondary aspect, all these issues of mental health, social health, and so on. And I think that, yes, it is true. And maybe this is the time to just really put it in the front, on the top of our priorities.
Well, I must say, from my own perspective, I was very, very pleased that the ESC decided to make this huge investment in what is, effectively, it was run like a guideline. The development process, it had the same resources applied to it, 2 years and rigorous investigation. Do you think, from your perspective, as a long-standing member of the ESC, was this a courageous act on behalf of the ESC and the Clinical Guidelines Committee, which authorized this investment?
I think it was indeed courageous. Probably still the background feeling is that still we have to focus on evidence, guidelines, and this is not a guidelines because we don't have a strong evidence. So this is a consensus statement, but the courage to say, hey, let's put this on the table as the CPG, as the committee, the guidelines committee, to show the priority that ESC has on patients' welfare and patients' health as a whole. I think it was a courageous move, and actually very unique, I would say, in international societies.
I think that's the case, and as I say, I'm delighted that the ESC is invested in this, and I hope that people take interest in it, and the supplementary information that's available in the document as well. I wonder, if I can then turn the tables, in a way, I suppose maybe I should be answering this, but as one of the co-chairs of this document, how do you think that the patient involvement in the task force activities and perhaps the earlier activities from the patient forum might have helped shape the outcome of this document and other recent documents and activities of the ESC?
You are obviously critical. Actually, probably if you were not here, but also in the guidelines committees, probably this would not have not come up. I mean, your voice, and I think it's so impactful. The documents showing the patient perspectives and show what are the feelings of patients with the disease and how far they are from, let's say, clinical cases or perspective show. So I think rather than having the patients as partners in this document, you are the heart of this document, the reason for this document, and not as a part of the vision of patients on one of the specific clinical aspects, but really the heart of this document.
Well, I think that's a really nice point to say, and I think it also concludes our time. We've run over time. So thank you very much for your attention. Thank you, Hector. And I must say, it was a real privilege to be part of this committee, and I'm very proud of this document. And I would encourage people to read chapter 13, which shows you the clinical cases and also some of the patient stories, which were foundational in the discussions we had on that task force committee. So thank you, Hector.
Thank you. It was my
Thank you for
privilege as
watching.
well.